when it comes to mental health, we don't take it seriously enough. When somebody is unable to get out of bed, when somebody is not feeling motivated to do the work that they have to, and it happens day after day, it's time to go to a doctor. It doesn't matter how fit your body is, if your brain is not working, then
Dr. Siddharth Warrier is a renowned neurologist and a content creator
who explains the mysteries of how the brain functions and how we can be more focused and productive with the help of neurology.
our brain is not wired to live in a world like this. Evolutionarily, we are still very much in the jungle, afraid of what is going to happen, afraid of what our tribe members think of us. And so when there's a notification, the reason we reach out to see what if there is somebody who is out there talking something negative about me, and we are really afraid of that.
On today's podcast, Sid encourages us to rewire our brain
and make mental well-being a priority.
What are the signs of a truly healthy brain?
There are two levels of brain health. One is metabolic brain health and one is cognitive brain health. I'll explain what these two things are. Everyone has a breaking point. The most disciplined person in the world will have a breaking point. Imagine what scrolling through reels does to you. Every 60 seconds, there is a change. If it's boring, you scroll to the next, you scroll to the next. So every few seconds, I need to be entertained. I need a spike of dopamine in my brain. That is considered as comforting. And this, according to me, is dangerous. If I have 1 week of your sleep data, I can give you a pretty good insight into how you're feeling.
Hi, Dr.
Hi.
Sid. Welcome to What the Hell.
Thank you so much.
So glad that you are here. Please have a seat. You know, I went through your interviews around the scam of happiness, and I couldn't stop wondering about this whole concept of happiness and the way we as humans chase it, and if it's actually a scam. So I directly want to start away with your thoughts on this entire topic.
Yeah, so this was a sentence that I had said a few years ago, that happiness is a scam. And I know that a lot of people must have misunderstood what I said. So let me just clarify. So a scam is something that promises something that it is not, right? So the reason I think happiness is a quote unquote scam is everybody says that this will make me happy. But when they get that thing that's supposed to make them happy, very soon that thing stops making them happy. And so we are always in this chase of something or the other, believing that this is what will make me happy or that is what is making me happy. So what I realized is that chasing after one particular object or one particular target and thinking that is happiness is the scam. So for me, I have replaced happiness with well-being, which is what is going to make you happy over the long term. So you can divide happiness into short-term and long-term happiness. Long-term happiness is definitely not a scam. Most things that give us short-term happiness is transient. And that's what I mean by scam.
Let's talk about well-being, right? Long-term happiness. What can we learn from a neurologist about well-being and long-term happiness?
So for me, well-being is very closely tied with brain health. So if your brain is healthy, you are able to appreciate whatever you have. It doesn't matter how fit your body is. If your brain is not working, then who are you at the end of it? So as a neurologist, I would keep talking about brain health. The good thing is that brain health is not different from body health. So when I talk about well-being as a whole, I've realized that it is impossible to keep your brain healthy if your body is not healthy. So as a neurologist, many times I find myself talking like a general physician, because what works for your body will work for your brain. And so you end up in a holistic space where if you take care of your body, your brain automatically becomes better.
I think this entire concept of healthy brain is new and doesn't come very naturally to me as well, right? Because a lot of us say, "Acha, mera gut healthy nahi hai," मेरे जॉइंट्स पेन है तो जॉइंट्स हेल्दी नहीं है, फिटनेस, वेट, लाइक ये सारी चीज़ों के बारे में हम हेल्दी अनहेल्दी बातें करते हैं. ब्रेन के लिए क्या है? हाउ डज एन इंडिविजुअल नो कि मेरा ब्रेन हेल्दी है या नहीं है, एंड व्हाट आर द साइंस ऑफ अ ट्रूली हेल्दी ब्रेन?
There are two levels of brain health. One is metabolic brain health and one is cognitive brain health. I'll explain what these two things are. Metabolic brain health is how the brain takes in energy and how it spends energy. This is the same as the rest of the body. So if your metabolic health in the rest of your body is good, your metabolic brain health is also good. The things that come under metabolic health is what you eat, how much you exercise, how much you sleep, all of these things. So these things will help the liver, the kidney, the heart, and the brain in the same way. But what is special about the brain is that it's not just metabolic health, you also have cognitive health, which is how you think. And this is a skill set that each person needs to develop by themselves. How logical they are, how rational they are, how much can they plan. So this is what makes the brain unique. It's not just eating, dieting, exercise, it's also cognition. So when I think of brain health, there are these two levels, and both of these things have to be worked on separately.
Cognitive health, right? How can an individual, let's say at the age that I am, what can I do in my life to build better cognitive skills? वो कहावत होती है ना कि खाली दिमाग को छोड़ो तो. So is that true?
Absolutely. Yes. So cognition, like anything else, is a matter of practice. How much you practice those cognitive skills helps you in other areas as well.
Okay.
So, for example, there are some of my patients with early onset Alzheimer's. So they are people who have started forgetting some names. They have some trouble recognizing patterns, and there are a lot of these games that you can help them with, say jigsaw puzzles, Rubik's Cube. So these are games that you can use to train your brain to do certain skills, and that helps them in other life areas. So there are skills that you can develop, cognitive skills you can develop, that makes your overall cognitive brain health better.
Wow. So interesting. I can't stop asking about cognitive health for children, right? Because I'm sure in that formative stage, especially when you're born 0 to 3 and then 3 to 18, I have read that a lot of things can be done to improve brain cognitive health. Please tell a little bit about that too.
So one of the challenges of the growing brain is figuring out how to direct your energy or direct your thoughts, because now that there's a brain model in front of us, we can actually use it to explain, which is the lower part of the brain is the primitive brain. Okay, so I'm going to, let's see, yeah. The part of the brain that the child is born with is this lower part, which is the limbic system. And this is developed in children also. As the child grows, once the child is say 10, 12, 15, this upper ka part, the prefrontal cortex, that gets evolved. So when a child is growing, what the brain is trying to do is the prefrontal cortex is learning to exert control over what the old limbic brain is telling you. And the limbic system is mainly involved in impulse. It tells you that, oh, if there is a cake in front of you, go eat it. If you're not getting what you want, start crying. But an adolescent needs to learn to control those impulses. So that is what child cognition is all about, learning to control your impulses. And sometimes it's interesting to think of how many adults still haven't learned that, because these are skills that you're supposed to learn as an adolescent, and even 30-year-olds sometimes struggle with controlling their impulses.
So what can we do with kids? Are there any tips and tricks that helps them build a stronger cognitive function? Reading, learning more languages. Are there any simpler things that parents could do with their kids?
So for me, there are 3 different brackets in which a child can improve their cognition. One is language. So language is the way that you interpret the world, And so the more words you know, the more granular the world becomes. So the more clarity you have on the world. So think of it like pixels, right? So the more pixels there is, the clearer the image. Similarly, the more words you have for emotions, for situations, they are able to appreciate those things more. So definitely reading books, learning more languages, all of these things help from the perspective of more language. Second thing that helps is expression of language. So it's not just knowing the words, but how good you become at expressing what is in your mind. So translating emotions into words, and that is why journaling helps. Very recently, I spoke to a 6-year-old who's been journaling for 2 years.
Wow.
And I realized that maybe a lot of things have changed in the current generation, because children are picking up these skills earlier and earlier, and it's wonderful to see how expressive they are, how much can they write. They've started writing diaries at a very young age, and it's helpful because it will help them navigate this complex social environment they're in right now. Another thing that is very underrated is how important physical balance is for cognition, even in children. So the more they play, uh, there is this chemical in the brain called BDNF, which is called brain-derived neurotrophic factor. And in the last 20 years, the amount of research that has come out in how important this molecule is for a growing brain is huge. And one of the things that increases this molecule is exercise. So nowadays, this was not a problem before, but nowadays, so many children are spending most of their time at home in non physical activities, like on computers, on mobile phones. So a lot of parents know that too much screen time is bad, but it's not actually the screen time that is bad, it's the lack of other physical activity that is bad. So the more the kids move physically, the better their cognition becomes. So in fact, parents should encourage children to play sports in order for them to become better at academics. Many parents will get confused between these two and think that nahi, sports theek hai, let them study more, but it's actually not either or. You need to move in order to
Be
become better
smarter.
students. Yes.
Wow, I think very useful and very interesting. And I was going to ask you, is there anything that we need to avoid? And I was going to refer to screen time.
Yeah.
That is there anything that deteriorates cognitive function? And I was guessing screen time to be one of those.
It is. It's not just screen time per se, but what you are watching on the screen. And now, because it's a new phenomenon, research sort of lags behind a little bit. So we will know in 10 to 15 years what are the long term impact of spending too much time on social media. But we can make a few educated guesses, which is, imagine what scrolling through reels or YouTube shorts does to you, which is every 60 seconds there is a change. If it's boring, you scroll to the next, you scroll to the next. What is happening is that we are developing a pattern of expectation of reward very quickly. So every few seconds, I need to be entertained. I need a spike of dopamine in my brain, and that is considered as happiness, or that is considered as having a good time. Even more importantly, that is considered as comforting. And this, according to me, is dangerous, because now what will happen is, and we have already seen this even amongst our peers, if you feel a moment of boredom or a moment of discomfort,
You go for your phone.
you reach out for your phone. You may not even realize that you're reaching out for your phone, but you'll suddenly find yourself scrolling. It's not because you want entertainment, it's because you want comfort. In that moment, scrolling is a soothing thing. So our brain now identifies this to be the baseline comfort. And whenever this is not there, we reach out for it. I have seen people scroll through reels while in a movie theater watching a film, because the film story is not entertaining enough. You are now scrolling while in a movie theater.
My father was here, and I have a 4-year-old, and he gets very little time with his nanu, right? In the little time that he was there, he was mostly on his phone. And he was not even realizing that how much time he's on the phone. And most of the time, it is not for important things. I think our brain doesn't realize what is important and not. In fact, with me, I go for my phone to do some task. I actually forget कि phone उठाया क्यों था. And there are these notifications and Instagram and shorts and WhatsApp forwards and so many things distracting me that I forget मैंने क्या काम के लिए ये phone उठाया था.
It's quite hypnotic.
It's crazy, and I think we all are victims here, from grandparents to children. Let's talk a little bit more on this, right? And how this really impacts focus. Tell us, for normal people across ages, how does this world of notification phone is impacting us, and what can we do to really work towards a more focused life?
Step one would be to understand that our brain is not wired to live in a world like this. So our brain is wired to look for safety, for security. And evolutionarily, we are still very much in the jungle, afraid of what is going to happen, afraid of what our tribe members think of us. And so when there's a notification, the reason we reach out to see is, what if there is somebody who is out there talking something negative about me? And we are really afraid of that. On the other hand, if there is somebody talking positively about me, we get a big happiness, like a rush of thrill. It's
Wow.
like, oh wow, this means that my tribe approves of me, and that means they're not going to kick me out,
Wow.
because that would mean I will die. So our brain is very much wired to live in that kind of environment, and we have never grown beyond that. So understand that every time you're reaching out for your phone, you're actually reaching out for security. You're seeking safety all the time. So knowing that this is why you're doing it, you're not doing it to be happy. You're not doing it for education, entertainment. You're doing it for safety. Just accepting that makes you realize a lot of your own behaviors. And then you can ask yourself that, okay, if safety is what I need, let me think about what else can make me feel safe. Will spending some time with my friends make me feel safe? Spending time with my parents make me feel safe? Whatever it is, let's go for that. Let's do that instead. The other thing that I realized from personal experience is how amazing is airplane mode.
Ah.
And I realized this in the most typical way, which is I was flying and I found myself picking up the phone in the middle and realizing that, oh, of course, I won't get notification. And I could actually get a lot of work done in the flight, to the point where I have started putting work to be done during my flight, just because I know that I have 2 hours of really productive time in the flight. So what I started doing recently is trying to create that bubble at home. So I would just assume that, okay, from 12 to 2, I'm in a flight. Hey, what can you do? I'm in a flight. So switch off or put your phones on airplane, put your watch away. There are so many gadgets now to put on airplane mode, but just do that. And whether you work or not, you will still create a bubble for yourself where you are disconnected. And I have started doing this as an exercise, not even for productivity, just as an exercise for yourself to see if you can do it. And turns out that once you do it a couple of times, it becomes easier. And now you are carving out time for yourself to do whatever you want. So creating these bubbles once a day, once in 2 days is extremely important. I can't stress this enough.
Yeah,
Everyone should do this.
I think very good idea. It could be for work, it could be for family time, right?
Correct.
I see couples out for a dinner and both husband and wife on phone. And when husband keeps the phone down, he sees the wife on phone and then he's like, ye to phone pe hai. Then when wife keeps the phone down, she sees the husband's on phone and she's like, arey ye to phone pe hai.
Absolutely.
We have really messed up our lives.
Absolutely. So there has to be clear rules of internet-free bubbles, where you put your phone facing down or you put it on airplane. Airplane is beautiful. It's underused. So just put it on airplane. And if somebody calls up later saying, hey, you are unavailable, just say that you were in a flight. It's fine. So use airplane mode more and more, and you'll find your life getting easier.
Beautiful. moving on to this whole thing around procrastination, right? I see that certain people uh, have the tendency to procrastinate, and certain people are pretty good. Um, um, Certain people are very good at building new habits. They're more disciplined. They are, they know how to live in a routine, and certain people are terrible at it. How can we as individuals identify these things and um, take some tips and tricks from you to really work upon our procrastination?
So when you start doing things, you realize that you have many interests. You want to do well at your job, but you also want to watch Netflix. You also want to sleep. You also want to go out traveling. So there are many things that pull your attention. And doing all these things is important for you to have a well-rounded life, right? So the whole hustle culture of being obsessed with just one thing doesn't really sustain. You do need to keep rotating between things. So I don't want to be too harsh on people who have multiple things going on. What I've realized is the idea of having something that you're passionate about solves for procrastination. In other words, when you find yourself procrastinating, it's not really a discipline problem, it's a passion problem. You have not found a task that is pulling your attention as strongly as Netflix or any other distraction. So instead of punishing yourself too much for saying, why am I not like this? Why am I not disciplined? Question the passion. Is this not interesting enough for you? Do you really not care about this so much? And it's okay if you are not passionate about it. It just means you have to find something else that you're passionate about. And there was a analogy in physics which I really like, which is iron filaments, right? There's a box of iron filaments and they're all scattered all over the place. But then on one side of the table, you put a strong enough magnet and all the iron filaments align themselves in one direction. All the chaos is gone, all the confusion is gone, as long as you have that one thing that really pulls you. So I think it's a beautiful thing for each and every person to find that one thing that they really care about. All of this gets sorted out. I wouldn't put too much pressure on why am I not like this. Finding that passion is what solves for it. You can also call it the North Star. I really love that term, the North Star. What is it that guides you and guides all your decision making? So procrastination means you haven't found it.
I think very good way of looking at it. Want to discuss a little bit about the routine aspect that I spoke, right? And especially habit building. Would love to understand from you, from the neurology, angle, what can one do to build a new habit?
So let's break it down into step by step. Okay. So there are 3 levels in your brain where a habit is formed. The first level is impulsive. So when you see something, you will do it. So for example, if somebody who likes to eat chocolates, they see a chocolate, they'll eat it. This is an impulsive level of action. The second level of action is thought out. Let me eat a chocolate. So then you will go out, you will buy it, and then you will eat it. So this is at the level of the prefrontal cortex where you think of doing something and then you do it. So it's not impulsive. The third one is the habit, which is you're not acting impulsively, you haven't thought about it. It's just that time of the day. So it's that time of the day, I will do it. So people who go to work out every morning and who have formed a habit out of it, or let's put less pressure on people, brushing. Okay, let's think of brushing. You wake up, you brush. It's not impulsive and it's not a thought. You just do it. It's as if your body has a mind of its own. So that is when a habit is formed. But no action can become a habit without going through those first 2 stages.
So when you do it repetitively,
Enough number of times. But it starts off as a limbic action. It starts off as an impulse. So most people who work out the first day, they have gone with some sense of either frustration or motivation. They saw somebody else looking really fit. So that is an emotional decision. कि मुझे भी सिक्स पैक चाहिए, मुझे भी हेल्दी बनना है, मुझे भी वेट लॉस करना है. It is a decision coming from ego. It is a decision coming from emotion. After a few days, those emotions die out. So if you are depending on the limbic to do those actions, it will not last. After that comes the prefrontal cortex, that no, I have decided to do it, matlab I will do it. So you do it out of willpower. That will take you further 2-3 weeks more. But eventually, willpower also dies out. So if you are doing an action based only on your willpower, it is not going to work. Eventually, the action has to come to another area in the brain called as the basal ganglia. Basal ganglia is the part of the brain that does repetitive actions. And basal ganglia is synced with the time of the day, it is synced with the environment. And once the basal ganglia takes over an action, then both the limbic and the prefrontal cortex are free. You're not
Wow.
dependent on your emotion. You're not dependent on your willpower. That is when an action gets converted into a habit.
I think इसलिए there are timelines around कि if you do one thing at one time for 40 days, for 120 days, I've
Yeah.
heard this,
Correct.
then it becomes a habit. I think we are basically, and that's why there are these challenges, 40-day challenge. Streaks, right? That makes sense. Now we know what happens in the brain.
Absolutely. And there are these tricks that you can use to help yourself, which is make the environment as conducive as possible. So for example, if you have to go to the gym, then you have your gym bag and your shoes outside. So when you wake up, you see it. Now you are more likely to do it. Whereas if you've kept your shoes inside a cupboard locked, now you are less likely to do it. So there are things you can change in your environment to make those actions easier. But if you are trying to form a habit, be honest with yourself as to which level are you in. Are you at the limbic phase? Are you at the prefrontal phase? Or are you at the basal ganglia phase? So that helps you track yourself better.
Is there any thing around timing, right? Where, like you mentioned, brushing, right? We do it every day when we get up, right? So it's also associated with the act of getting up, walking to your washroom and start brushing. If I start working out today and I say that, hey, I need to build a habit and I'm, let's say, starting off, and I do one day in the morning, one day in the evening, randomly, third day, chalo dopair ko kar leti hu, it will be difficult to reach the basal stage.
Ganglia, yes. So there are two things here. One is the timing, absolutely. When you wake up, it is associated with an action before. So waking up and brushing have become linked together. And since you will wake up every day, if you don't brush, in your mind, you will always have the sense of something incomplete. So I have not finished waking up. And so when you don't brush and you go out, you'll feel like, yaar, kuch to galat hai, I've not really done it. And the other very important thing is the association of cleanliness or being fresh with brushing. So if you haven't brushed, in your mind, there is a psychological weight of not being fresh. Suppose you ask any gym goer who has been going for the last 1 year, they will say that the day I haven't worked out, I don't feel energetic. And this connection of working out and being energetic, once that comes in, you will find that it is much easier to work out every day.
And the whole association has changed, right? The beginner is thinking, मुझे 6 abs चाहिए, मुझे
Correct.
weight loss करना है.
Correct.
But the regular guy is thinking कि मुझे आज workout करना है क्योंकि मुझे आज अच्छा feel करना है.
Exactly. So it is not about the long term. It is actually in the moment. I'm working out to feel good now. So this is a very interesting loop that happens in habits, which is it starts off as immediate emotional. It goes into long-term health, acha hoga, but then it circles back into, no, I want to gym because it makes me feel good now. And if I don't, then I will feel bad. So that loop, once it happens, then it's a beautiful thing.
Wow, very interesting. Doctor said, so many places we hear references of the Einstein brain, right? Are some people just born smarter and is that visible in the way their brain is structured, or when you analyze or look at brains?
Yeah, the idea of child geniuses is very popular. And there are so many stories of children, some children being able to do incredible feats. It's definitely true that genetics plays a role in how a child is able to perform certain tasks. So there are some children who will start walking earlier than others, some children who are much better at mathematics than others. But the way I see it is that every brain is capable of recognizing patterns. Now, which patterns that brain recognizes might be different. And if you are lucky, you will know that this child is very good at recognizing these patterns. The mistake that we make is in saying that some patterns is equal to intelligence while other patterns are not. But to the brain, it's all patterns. Now, whether that pattern is musical notes, whether that pattern is numbers, whether that pattern is how to move your hands and legs on a football field, is up to that brain to decide, right? But we are the ones who classify it and say that, oh, this is a useful pattern and this is not. So that's where I feel we do some children injustice, thinking that this is what intelligent means and this is not. That being said, once a child grows up, roughly speaking, the importance of genetics reduces and the importance of environment increases. So when a child is 16, 17, 18, um, who they were born to is not as important as what kind of environment did they grow up in. So Einstein becoming Einstein is not just a function of the genetics that he has, but also a function of all the things that he was exposed to and he did, and how much he tried and how he didn't give up. So other things like resilience, willpower, discipline, all of those things come in. And the thing that comes in the most, I think, is something that we already spoke about, which is passion. There will be children who are extremely talented, who are able to spot patterns very well, who are able to learn things very well. But if they don't find something that they feel is worth trying, all of that so-called potential will never really meet its um, fair target. So I think it's a combination of both building a child's talent and helping them find something that they're passionate about. Both of those things have to align for that magic to happen. So when I think of Elon Musk, for example, or Einstein, or anyone who has done incredible things, it is a combination of their brain being skilled enough and them finding something that they're passionate about.
Makes complete sense.
Yeah.
I have to discuss about mental health that you are here. I think overall we talk so much about health, and when we say health, we refer to physical health. Not equal importance is given to mental health. And then I think we are, as a nation, improving. If you look at last 20 years, there's comparatively more awareness about things like anxiety, stress, depression. But would want to start with depression with you, right? As a neurologist, what's happening in the brain of a person going through depression? Because a lot of people still think that it is just that person's problem, or it's the situation, or it's right, and hence probably stay away from looking at it like bukhar. So is there anything in the brain that happens when somebody goes through depression?
Absolutely. There are many things that happen in depression that can be now, today, can be seen on functional MRIs, that can be measured, but that was not the case before. So throughout history of medicine, one of the challenges that we've often faced is, how do you define something that we can't see or we can't measure, right? And there are many diseases that we understood only after technology developed enough for us to measure those things. So even things like liver disease or heart disease, before there was angiograms, before there were blood tests to measure serum bilirubin or ultrasound to see the liver size, how do we know how sick someone is? right? If we only go by what they say, that is very subjective. And because suffering is subjective, if you are in pain and I'm in pain from the same cause, we might suffer differently. The pain you feel and the pain I feel will be different. So how do I know how much medicine to give you? How do I know how to treat you if everything is subjective? Whereas if there's an objective marker, now I know. So if there's one artery in your heart that is blocked, now I can do an angiogram, see that, okay, this is 70% blocked, this is 90% blocked, and I can stent you, I can give you medicines accordingly. In depression, these grades are not there. So everything is subjective. In all mental health problems, everything has been subjective. And as soon as something becomes subjective, it is open to misunderstanding. You can say that, oh, you can't be in so much pain. Come on, you can't be suffering so much. There's a very popular study that shows that people always underestimate the pain that someone else is going through. Always. So if someone pricks me with a needle and I react, you as an observer will always feel like, oh, ye to zyada hi kar raha hai. It can't be that painful until you get pricked. And then you realize, oh, it is quite painful. So all of the discussion around mental health is actually this bias, which is when you see someone else suffering, oh, it can't be that much until you feel it. What happens in depression is a series of biochemical changes that affects the brain's networks one by one. So there is a memory network that gets affected. So somebody in depression will have trouble remembering things. There is the focus network, so they will have trouble focusing. There is the planning network, so they are unable to plan beyond a few hours or a few days. So somebody in depression may not be able to say, next month I'll do this. They're not able to because that network in the brain isn't active. And because of this cyclical problem, because they're not able to plan, they make poor decisions. Because they make poor decisions, their life becomes worse. And now they feel less motivated. So it becomes a spiral. And that is why depression is so complicated. And the earlier you diagnose, the easier it becomes. If it becomes if it's a chronic depression, the changes in the brain can very often become so bad that they may need admission, they may need hospitalization. Whereas early on, counseling and medication would have been enough. So it's definitely physical changes happening in the brain, and B, treatable if caught in the right time.
How does one know that it's time to go and seek help, right? Because there is, in the early stage, especially because you said it's important to seek help in the early stage and the right time. How does one differentiate between sadness or feeling low versus depression?
So all symptoms have a range from physiological to pathological. So our body is capable of feeling things which are transient, and when it becomes pathological is when your functions get affected. So functionality is the key differentiator. You fall down, you injure your knee, the pain comes in and it goes away after a while. You are fine. You don't really go to an orthopedician. But suppose next day you find it difficult to walk. On the fourth day also you find it difficult to walk. And when you run, suddenly your knee collapses. Now you know that, okay, something is wrong. So step one would be to know your body, to know that, okay, this is unusual. I have not felt pain like this. Maybe I should go to a doctor. And instinctively, everyone knows this. We don't have this conversation when it comes to fractures. Nobody has ever asked anybody that when should I go to an orthopedician. People instinctively know. But when it comes to mental health, we don't take it seriously enough. So when somebody is unable to get out of bed, when somebody is not feeling motivated to do the work that they have to, when they get a phone call from their boss or when they get a phone call from their parents and they just don't feel like answering, and it happens day after day, clearly their function is getting affected. It's time to go to a doctor. Just like in physical health, mental health is not different. When your functions are getting affected, please go to a doctor. You don't have to diagnose it yourself. It's not our job as a population to diagnose mental health. That is why there are specialists. But it is kind of our job to seek help. Unfortunately, we have to take that responsibility of seeking help. And then the responsibility goes on to the medical professional. They are the ones who have to diagnose you. They are the ones who have to differentiate sadness from depression. You don't have to do that. But if you are so sad that your functionality is affected, seek help.
I absolutely loved the answer.
Yeah.
Made so much sense, right? I'm so glad you did not teach us how to differentiate sadness for depression, because all that matters is to know when it's time to just go and seek help.
Absolutely. And that's why there are specialists. We don't have to know ourselves. It's the only responsibility we need to take is seeking help.
Are there certain behaviors or personalities that are more susceptible to depression and certain that are not? And what I mean by that is a layman observing people around, right? I know certain people who are, when they are at that edge of falling into depression, they know what are the mistakes that one can do. For example, they have that attitude to fight back and say, nahi, let's start workout. Let's go. We have to shower every morning, no matter what. And when you push through, sometimes it helps you not fall into that spiral very quickly, versus there are people who just give in, whether it's sugar, whether it is just that self-control on the brain.
Yeah.
Right? And I feel that certain personalities tend to fall into depression very often because they make the mistakes. So is personality an important contributor? And the reason I'm asking this is, as individuals who are listening to this chat who are not going through depression, can we do something to prevent? Can well-being be sorted so much that we prevent reaching that stage?
It's an important question. There is a certain bit of nuance to be added here, because when it comes to physical health, it is a very easily understood concept that if you take care of your physical health, you are reducing the chances of something bad happening to you. For example, heart attack. A heart attack can happen to anyone at any time, but there are some lifestyle choices that you make that can increase or decrease the chances of a heart attack. The same thing applies to mental health, but in mental health, it has to be very, very clearly communicated, because the prevailing misunderstanding is so much that it can very easily go into victim blaming. That you are depressed because you didn't do these things. That is unfortunate. We should not have that conversation. But at the same time, absolutely, there are risk factors to depression that we can mitigate, we can avoid if you start early enough. And one of them is physical activity. Because like we spoke about at the start of our conversation, the brain is not disconnected from the body. When the body becomes healthy, the brain becomes healthy. And there are enough and more studies showing the impact of exercise on both avoiding and treating depression. There are studies comparing exercise to medication. There are studies comparing exercise, dance, yoga, and medication. And there's a lot of comparability to this, because when you exercise, the chemical changes that happen in your body are protective against depression. So the way I see it is, how much reserve can you build? It's all about reserve. Everyone has a breaking point. When it comes to your body or when it comes to your brain, your mind, everyone has a breaking point. The most disciplined person in the world will have a breaking point. But where is that breaking point? And can you give yourself enough reserve? Can you give your heart enough reserve? Can you give your liver enough reserve? That, say you have a bad day of eating, or you have one alcoholic drink more, if your liver is at the edge, that could be the drink that ruins everything, right? But if you have enough reserve, if you've not had a drink in 5 years, and if you've been eating healthy, sleeping healthy, that one drink will have a very different effect on you, because now your body is healthy. Similarly in the brain, if you've had a good night's sleep, if your baseline mental resilience is good, one stressful day will not tip you over. If you've already been stressed out for a long time, that one bad phone call could tip you over. So I absolutely believe that there are certain lifestyle changes you can make to reduce the risks. But once it happens, everyone's on the same boat. You need medication and you need care.
I think fair. Is depression also genetic? And are there types of depression that people should know about? I think that would be useful for people to know.
Yeah, it is a good question. There are a couple of terms that everyone should know about. One is monogenetic, one is polygenetic, and one is epigenetic. So monogenetic is when one single gene will cause a disease, irrespective of everything else. For example, Huntington. If you have that genetic problem, it is likely that you will have the disease, irrespective of where you grow up, what environment you are in, what you eat, what your personality is, what you do, irrespective of all of that. Then there are polygenetic problems where multiple genes interact to create that disease. As soon as you say something is polygenetic, it means that environment matters, what you eat matters, exercise matters, and two children with the same genetic potential growing up in different households will have different outcomes.
So would diabetes come under polygenetic?
Yes. Diabetes, blood pressure, to some extent even cancer. There are some monogenetic cancers as well, but by and large, and depression is polygenetic. So while yes, genetics do play a role, we can't say how much role independent of everything else. And for me now, the most important word is epigenetic, which is that we think that we are born with certain genes and those are the genes that remain for the rest of our lives, but that's not true. Environment changes genes. So there are many factors which are called epigenetic factors that go into your body, that go into your cells at the genetic level and change your genes based on the environment, based on what you're exposed to. So don't think that because you're born in a family which has certain risk factors, you will have the same outcome. Environment matters. At the genetic level, environment matters.
Wow, I think that is so powerful because a lot of us think, अरे मेरी मम्मी को था तो मुझे तो होने ही वाला है, अब मेरे हाथ में कुछ नहीं है, so मतलब मैं क्या ही कर लूँ types.
That's not true.
I mean, that's just so hopeful. It's end of the day, everything is in our hand, and a lot of it is in our hand.
Yes, and it is empowering. One of the problems of this discussion around health is that while we give a lot of information, I feel that we don't give enough empowerment. When you say that, oh, this is not your fault, at the same time, we should also be giving them, what can you do about it? Because saying it's not your fault is actually taking away power. Because when you say it's not your fault, what we are actually saying is there's nothing you can do about it, which is not fair, especially if there is something you can do about it.
Fair, makes complete sense. Let's go to physical manifestations of depression, right? Let's say, unfortunately, somebody ignores the early signs of depression and it reaches a point where there are physical symptoms that tend to develop. What are those? And the reason I want to cover this is, at least at this stage, it should be a big call to that person that I have to now go seek help.
Yeah. So different areas of the brain get affected and each of them cause a different physical outcome. One of them would be that your sleep cycle is altered. So this is pretty much an early sign of depression. Although any of the signs of depression can come first. There's nothing like this is the first one to come. There could be somebody who starts changing their eating habits. They might eat too much or they might eat too little. Both of them can happen. Similarly, in sleep, somebody could be sleeping too much or completely avoiding sleep. Both of them can happen because it's the network that is the problem. Once the network gets altered, it could go either way. So a change in sleeping habits, a change in eating habits, a change in interest. So things that you were interested in before, suddenly you are not interested in anymore. You have no motivation to do things. You have no motivation to move. A very common thing that is seen in depression is lack of movement. So,
And
the,
that's so contradictory to the fact that you should be doing physical exercise to.
yeah,
Wow.
it's a cyclical thing. So, the chemical that most people know about is dopamine, and dopamine activity falls in depression. Dopamine activity also falls in another disease called Parkinson. And in Parkinson, if anybody has ever seen or heard about a Parkinson patient, one of the key things in a Parkinson patient is bradykinesia, which means low movement. So their brain is fine in the sense that they are able to think clearly, but they don't move. They're not able to get up quickly. They're not able to walk quickly. And the same thing can happen in depression. In fact, when I was a neurology resident, my professor used to tell me that whenever you come across a Parkinson patient, make sure they're not depressed, because you might be misdiagnosing a depression patient as Parkinson. So this is also one of those things that a depression patient will speak less, will move less, will have less facial expressions. So these are early things that you can pick up, and it's kind of the responsibility of the people around them to pick these early things and then just say that, hey, listen,
Something
I
is
see
different.
you're changing. Is everything okay? Do you want to talk? And do you want to get help? I'm not saying the responsibility of treatment is on them, but the responsibility of noticing these changes is on them.
Is there a duration to this, right? Let's say one gets up in the morning and suddenly feels ke nahi man kar raha bed se nikalne ka, right? Which is a sign that you
Yeah.
said. And this happens day 1, day 2, day 3, day 4, day 5, day 6.
Yeah.
When is the time for the person to say ki nahi, now this is, it's not a low mood, PMSing. It is something where I should seek help.
The first time they think this thought,
Hmm.
that this is unusual for me, that this is something that I've not done before, and maybe there's something wrong, is the time to go and seek help. And the more somebody is in tune with their body, the earlier they will catch it. So again, the first step would be awareness. As soon as you know that this is my usual schedule, and this is not something I've ever done before, if the first time that thought comes, you should seek help. You should just go and talk to someone. Because what happens is, and this is very, very important, in mental health issues, whether it's depression, whether it's anxiety, there are many things that are going on in the brain, but one common thread is that your prefrontal cortex activity goes down. You are not able to think as rationally as you would have otherwise thought. So now you are thinking from your limbic system, from your emotional brain. So what happens when you go and talk to a friend or a family member is that their prefrontal cortex is working fine. So now they are able to look at your situation rationally, and they can take a call that, yes, you are right, you are behaving differently, you should seek help. Because saying I need to seek help is in itself a rational thought. And many times somebody with a mental health problem might not be able to think that.
That makes complete sense. I personally went through postpartum depression the first time I had a kid. And eventually, and I am informed, I know about postpartum depression, but I actually didn't realize that I was going through postpartum. When I started recovering is when I said, hey, I need to seek help because I think I went through it. But it was already sorted, I think, by the time I started seeking help. And of course, the help really helped me come out of it quickly. But this makes complete sense. I don't think my brain was smart enough to take that rational decision that I should go and seek help.
Absolutely. And again, from say a physical example, if somebody has an accident and both their legs are injured, telling them that they should walk to the hospital is kind of rude and not practical, because that is the part that is injured. And it's very similar in mental health, which is at that point, your prefrontal cortex is not working as well as it should. So telling them that no, you are responsible for doing this is difficult. And this is one of the challenges of mental health, because on the one hand, yes, they are responsible for seeking help. But on the other hand, what if they can't seek help? So this is where your community comes in. This is where your friends and family come in. And not to take responsibility for treatment. Again, they are not trained for it. They should not be taking that responsibility. It is too much. And then they will go through a cycle of guilt and all of that. But just noticing that, hey, I don't think you're okay. Let's go take help. That much I think we owe to each other.
Makes complete sense. I think one of the stigma to go and seek help is built around medications. People are scared of taking neurological medications, right? Mental health medications. And there is this whole thing around them being addictive and the fact that you'll get dependent on it, etc. As a doctor, what would you want to share here?
All medication is given with a purpose, which is you are here on this earth for 80, 90 years and you need to live the best life possible. And so whatever it is that we need to do to make sure that that happens is what the goal of medicine is. And medication is a part of it. It's definitely not the only thing that works. And very often, in fact, only medication does not work. It's unless something is as simple as malaria causing fever, right? So if something is as simple as that, sure, here's your medication, take it for 7 days, you're fine. Which is why infectious diseases were the first ones to be taken seriously. And anything which has lifestyle changes were given importance much later, right? Even in the case of physical health, heart disease is now being given importance. But when tuberculosis and the plague was going on, nobody cared about heart disease. So people and medicine often solves the lowest hanging fruit or the most urgent problems. When you talk about mental health, whatever it takes to make somebody live the best life possible should be done. And if that means taking medications for a while, for a few months, this stigma is unfortunate. And I think it will go away. In fact, in the US, the stigma is much lesser now. In fact, people are taking it quite a lot. In fact, where I would push back is saying that don't take only medication. Don't ignore lifestyle. Don't ignore everything else. But the stigma around medication is gone in the West. I believe that in India also it will go. But it is a responsibility of the medical care professionals to communicate that A, medications are useful and sometimes necessary in order for someone to come out of that problem. And B, medications are not the only way to solve it. All the time, it is a mix of both.
Makes complete sense. How is anxiety different from depression? And how does one understand that they have an anxiety problem that's now becoming serious?
Anxiety is another one of those words that is on a spectrum, which is there is physiological anxiety and there is pathological anxiety. Physiological anxiety is very good. It means that you are normal, your body is running fine, and that your brain's important defense mechanisms are in place. Somebody who has zero anxiety will not survive for very long. You need to have that bit of fear, because it is that fear that makes you look on both sides of the road before crossing.
Fair.
Right? If you're not afraid, then you're not going to last for very long. So you need that much. Utna chahiye tumhe. What happens is, when taking this example forward, you are so scared of a car running over you that you look on both sides of the road even when you're inside the house. That is when it becomes pathological. When you start imagining fears that don't matter in that moment. So what happens in pathological anxiety is that you take a fear which is fundamentally valid in a particular situation and extrapolate it to the rest of your life. To a point where, so generalized anxiety disorder is when you are just anxious. You're not anxious of a particular thing. You're just anxious. Kuch to hoga, kuch to hoga. Somebody will come. There's a doorbell. Who's there? My phone is ringing. Oh my God, what is going to happen? This is anxiety in a generalized state. There are specific anxieties, which is a person is okay for the most part, but they're anxious about, say, missing a flight. So whenever there's a flight, they will go 4 hours early. That is specific anxiety. And so this is a spectrum. The answer is always understanding where this anxiety is coming from. And this is what a good psychologist will do. And that's what a counseling session is, which is understanding why did you develop this fear? What was that initial trigger point? What made you? Because this is a belief system. For some reason in your brain, this pattern has come in that if I don't do this, my life is in danger. So we need to decode that, go to the root cause, solve that, and then gradually get better. So there is a system in place, and a counselor will take you through that system. Medication, definitely not the main treatment for anxiety. Important for acute cases, like if somebody is having a panic attack, maybe they do need medication. But to come out of anxiety, you do need good counseling.
Explain a little bit about panic attacks, right? What is a panic attack? And like you said, I'm guessing it's the acute stage of anxiety, right?
Yes.
How can people identify कि हाँ मुझे ये panic attack हुआ है?
Everyone instinctively knows when there's a panic attack. And most people may have gone through a panic attack which is valid. For example, if a student is going to their exam, they reach the exam hall and they find that they didn't get their hall ticket. Okay, exam is starting in 15 minutes and they forgot their hall ticket. They will panic. Most kids have experienced something like this. कि homework भूल गया, मैं bag भूल गया car में, bus में bag भूल गया. These things happen. And that moment, what you feel is panic. That feeling of, I need to act very quickly. I need to run somewhere. I need to do something immediately. But it is mixed with the sense of helplessness, that there's nothing I can do. So that is what the panic situation is. And sometimes it's valid. Again, very similar to anxiety, a panic disorder is when you take that panic feeling and you get it in a place where it's not valid. You don't need to panic. There's actually nothing that is wrong. You are not in danger, but your brain has convinced yourself that you are in acute danger. And so your body goes into what is called a sympathetic state or a hypersympathetic state. So your heartbeat increases, your muscles tighten up, your pupils go wide. You are, in effect, getting ready to get into a fight. So your body is taking up a lot of energy to get ready for a fight. Your body thinks that you need to fight something right now. And you are basically looking around to see, what do I fight? There's actually nothing. So this is a pathological panic disorder. You can think of it as an acute misunderstanding in your brain.
Wow. Okay, so we understood depression, we understood anxiety. Now let's go to something that all of us face, stress. I think stress impacts everything in our body, including hair loss and the rate at which one balds. Good 70% plus people that come for hair loss here face stress. And I think that data can be extrapolated to population in general. A lot of us don't even realize that we are going through stress. So want to understand from you, is there anything one can know to gauge? I wish there was a blood panel test for, hey, you are at stress level 3. To really know that, hey, what is happening is actually putting me through stress. So is there anything one can do to really avoid the damage stress does to body?
So there is no way to avoid stress in life, because let's understand what stress is. Stress is your body and your brain learning to deal with a new situation. So you can think of stress as discomfort, which is the opposite of comfort. So whenever you are doing something that you're very familiar with, you're used to doing, then you are comfortable. You are not stressed. But life doesn't work like that. So life may you are constantly coming into newer situations, newer challenges. And on a good day, you call it growth. Because if you were doing the same thing every day for 40 years, you would say, that, hey, am I really growing? So you want growth. Everybody wants to grow in today's world. Of course, everyone wants to keep exploring new things. But that is stress. That is exactly what stress is. Your brain is learning that, okay, this is a new challenge. How do I solve it? What is pathological stress is when this new challenge, the cost of failing this new challenge is too high. If you say that, like if I give you a puzzle and I ask you to solve it, that is stress. But you're happy. You're having fun. Let me solve it. Let me see what to do. But that same puzzle, and I tell you to solve it, and I say that if you don't solve it in 5 minutes, I will take away your car. Now suddenly there is fear. The cost of solving it is very different. So that is the difference between good stress and bad stress. The way that we interpret what will happen if I don't solve this puzzle makes it bad stress. And unfortunately, most people are in bad stress. They don't look at stress as a positive thing. They don't look at it as growth. They look at it as, I need to do this, otherwise I am a failure. That is where the negative stress comes in. That is where your body's inflammatory markers go up. Your body goes into inflammation. And there are markers actually. Even better is HSCRP. That is highly sensitive CRP. It is a good marker. The thing is, it's not very specific. It can't tell where the inflammation is coming from. So maybe it's a psychological stress, but maybe you just ate something bad. Or maybe you have a small boil in your foot. That can also lead to CRP going up, but it's a good marker. It's a good marker of overall stress. So if your HSCRP is very low, it's less than 1, then that's a good thing. There are other markers as well. There is uric acid, there's homocysteine. So there are multiple markers that you can use. There are also physiological markers like your heart rate variability. There are markers like your sleep patterns. If you're stressed out, your sleep is going to get affected. So if you check your sleep patterns, if I have 1 week of your sleep data, I can give you a pretty good insight into how you're feeling.
Wow.
And that in turn affects your mood, that in turn affects your skin, that in turn affects your hair.
I completely agree. I think, we have at What the Health had gastroenterologist, cardiologist, like doctors from all fields. And if I had to sort of conclude in one line, 3 important things that impacts everything, it's sleep and it's what you eat. And I always thought eating and nutrition and food is very important, but I never before this exposure realized how important sleep is.
Yeah.
And I think that's a very interesting piece that you mentioned. Now, if somebody is, let's say, going through stress, right? What I am inferring from what you explained is one way to manage stress is to throw fear out of the window, right? Which is try to, in what you do, take the fear of losing away so that it's less negative. But is there anything else we can do as individuals to manage stress better?
There is actually. So I think of the analogy of going to a gym. Okay. So if you are a new gym goer and you've gone there for the first time, you see people lifting up 100, 200 kilos, and here you are with 10 kilos and you're still struggling with it. You don't take that very personally. You don't think of yourself as a failure. You'll say that, okay, this is my first day, but now you have a goal and you know how to build up resistance. So from 10 to 12.5, 12.5 to 20, you will slowly build up. And in your mind, there is a roadmap that if the next day I try to lift 50 and I can't, then you will immediately calculate that, oh, 50 is too much. Let me go down to 20 and build it up to 50. Somehow this intuitiveness when it comes to physical challenges don't translate to mental challenges. So somebody who has never held a position of a manager will become a manager, struggle with it, and call themselves a failure.
And then get stressed.
whereas they don't need to. What they actually need to do is maybe work as an assistant to a manager with the purpose of learning what the manager does. And thinking about stress from this perspective, which is there are skills that I have, there are skills that I don't have. If I don't have them, it's not an identity thing. It doesn't mean main aisa hu. It just means these skills I haven't learned yet. And there is a way to learn those skills. So for me, how intuitive we are when it comes to our body is how intuitive we should be when it comes to mental stress. So if you can build that, if you can build reaching a certain level of proficiency in your skills in the same way that you would in a gym, then that would solve stress. It would mean that you know how to reduce the challenges, work on it, and then increase the challenges. For me, that is the best way to go about it.
Makes complete sense. I also want to cover a little bit about severe neurological issues like Alzheimer's, OCDs, schizophrenia, Parkinson's, and if there are more. And if you can, dementia. And if you can explain, in short, what these diseases are, because I'm not sure if everyone would be aware. And what can one do to prevent if there is something? Now we know about epigenetics, so
Yes.
we will definitely ask this question. What can we do to prevent these diseases?
There is actually things that we can do. So I'm very happy to talk about it because preventive neurology is a very important field that is just coming up, which is that after somebody has Alzheimer's, the way you treat them is different. But what if somebody is 40 years old and has a family history of Alzheimer's, and they want to make sure that they don't get it, or they get it 20 years after they would have otherwise gotten it, which is also a very big thing, because getting Alzheimer's at 80 versus getting it at 60 is completely different. Your whole life will be different. And that's something that I can really get behind, which is there are things you can do. So to answer your question, dementia is memory loss. Okay, so whenever you start losing memory, at one point of time, you will say that you have dementia.
And is it short-term memory that hey, आज मैंने खाना खाया कि नहीं मैं भूल गई, or is it मुझे याद नहीं कि मैं 5 साल पहले किससे मिली थी?
So it's a gradation. Usually short-term memory is what goes first. So Alzheimer's is the most common cause of dementia. There are other causes also, but mostly if somebody has dementia, you could say that they likely have Alzheimer's, unless proven otherwise. They could also have depression. So depression also causes dementia, like I said before. So if somebody has dementia, what happens is before they have dementia, they have something called mild cognitive impairment. It's called MCI. So this is like dementia ka chota bhai, like a very early stage dementia. If you can pick up somebody with MCI, there are things you can do to avoid dementia or prolong the onset of dementia, which is change the things that they eat.
Wow.
Yeah, it's a really important thing. So your diet plays a big role in when you get dementia. The quality of your sleep is hugely important when it comes to dementia. The amount of exercise that you get is very, very important. So there are certain exercise protocols that if you follow for say 10 years, the chances of you getting dementia reduce by 40%.
Wow.
Which is odds that I would take. It's
Absolutely.
right. So in fact, I would break it down for you. There is something called zone 2 training, which is your heart is beating at around 60% of your maximum heart rate. So for most people, it'll be around 120 to 140. If you can make your heart beat for 180 minutes in a week in that zone 2, the chances of you getting Alzheimer's drops by 30 to 40%. So that translates to say 3 sessions of 60 minutes each of your heart beating at that speed.
And it's so simple.
Just
Cardio.
do this. Just do this. So go somewhere where there's a treadmill or a cycle. It's usually the easiest one to keep track of your heart, and find your pace, find your rhythm, and just do it 3 times a week for the rest of your life. And that's it. As simple as that. But this should be known. People should do this. And they know that, yeah, cardio is important, but they don't know the numbers. And there are enough studies now to show that this works. So just do this much. And when it comes to eating, the biggest culprit is transaturated fatty acids. So reduce anything that could have trans fats, and the chance of Alzheimer's drops. So that's usually fried things from outside. Ghar ka khana is by and large okay, but things like processed foods, butter, junk food, usually that's the problem. So nowadays I tell my patients that, listen, if you want to eat a samosa, just make it at home. Just make a vada pav at home. It's fine. It's much better. Don't eat it from outside. And it's all about reducing the odds. Over a lifetime, if you reduce the odds, you will thank yourself when you're 60.
Yeah, makes complete sense. Dr. Sid, we spoke about Alzheimer and dementia. Can you also share a little bit about schizophrenia and other neurological diseases around that are very common and people miss out?
So schizophrenia is under psychiatry. While in the brain, of course, we can say that all of these are brain disorders at some level. Schizophrenia has traditionally been managed by psychiatrists. The pathophysiology is complex, but the symptom in schizophrenia is a change in reality. So the problem that happens in the brain is how your brain perceives reality changes. And people who are going through schizophrenia, depending on the stage of it, will have trouble coming to terms with what their inner reality is and what the outer reality is. And many times there might be things like paranoid hallucination. They might they might see somebody and think that, oh, this person is coming to hurt me or kill me, while that is not reality, but they will create that reality. So that is what happens in schizophrenia. It is one of those diseases which has a strong genetic component. And the earlier you pick it up, again, like any other disease, the earlier you pick it up, the better the outcome. Because then you can start with medication, you can start with counseling. It is a complex disease to treat, but now because of latest medications, the outcomes are good in schizophrenia as well.
Let's not miss OCDs, obsession. How do you define what is OCD?
So OCD is obsessive compulsive disorder, and you can think of it as a specific form of anxiety in which a person will feel that if something is not done in a particular way, then that is a threat. And there can be multiple triggers for such a person, and they will also have something called intrusive thoughts, which is a thought that comes into one's brain, which is common actually for everyone. Everyone gets intrusive thoughts sometime, that if you're cutting vegetables, you might just get a thought that, oh, what if I chop off a finger? A random thought will come in, but you are able to say, no, I won't do it. And then you've moved on from there. Whereas somebody with OCD, while they won't act on it, but they are so worried that they might act on it that they will take a lot of precautions to not do it, which means they will never cut vegetables. Some things like this. And it is a very distressing problem. The family members will get very distressed. So many times in an OCD patient, the counseling should involve everyone, because the family members are struggling almost as much as the patient is, because there is insight. Somebody going through OCD will still know that, oh, what I'm doing doesn't really make sense, but then they are still suffering through it. And the recovery from OCD is very often a long one, because they will need multiple group sessions, therapy sessions. There are medications also. But the primary thing is a form of anxiety, and they're not able to cope with that anxiety. So they will come up with different gestures or different actions that are soothing for them. So closing a door 3 times, or there are some of these things that
Washing hands.
These are all actions that give them momentary relief. So it's the brain's way of coming up with actions that soothe that anxiety for some time, but it's not a permanent cure. It's a disease that is very important to be picked up early on, and there are treatment options. So that's the thing with mental health problems, which is that when you hear of something like this, you might think, oh no, what a terrible thing. But what is important to know is treatment is available. A good counselor and a good psychiatrist, it's a team effort. A lot of these disorders will require a team to deal with it. And if given the right care, people can come out of it and they can live very fulfilling, quote unquote, normal lives. So that's important for people to know.
I think great. Last piece that I want to really discuss is this piece of addiction. And what does neuroscience teach us to battle addiction, whether it's somebody trying to leave um, smoking or alcoholism or any sugar addiction, any kind of addiction. We spoke a lot about building habits. Now I'm moving to losing or skipping a habit and taking it out of your wired brain. How do you do that?
Yeah, it's a more difficult task to break a habit than to form a habit. The problem with addiction is that while the action may start off as seeking pleasure, you're chasing a dopamine rush, but very quickly it becomes a soothing action, like a comforting action. So, similar to what we spoke about in scrolling, somebody who reaches out for a cigarette is not always reaching out because they want to feel the rush of nicotine. They're reaching out because they want to feel the soothing effect of nicotine, which is that once I light up and I take a drag, now I feel calm, now I feel comfortable. And without that, I'm feeling low. So they're not chasing a high, they're actually chasing normalcy. They want to feel back to normal. And that makes it a much more difficult challenge, because it's easier to give up something good, but it's very difficult to give up something that makes you feel normal. So depending on the stage of addiction, the challenge changes. I remember that when I was a resident, we did psychiatry posting, and I was in the de-addiction clinic in Lucknow. And my professor told me that you can tell when somebody is going to have a successful de-addiction program based on whether they come to the clinic themselves
Or somebody brings
or
them.
somebody brings them. That is the key component. If a person is coming in saying that, listen, I have an addiction, it means half the job is done. They have accepted that they have a problem and they are willing to work on it. If somebody else has brought them, that means that the person feels that everybody else is silly and I know something that others don't. And that is a more serious stage of addiction, because that means that the chemical has altered their brain networks to a point where they have started altering reality in order to sustain the addiction. And all people who have worked in addiction have seen patients like this, where they are clearly sick, but their level of dependence is so much that they have altered reality, saying कि नहीं नहीं इसके वजह से नहीं है, the alcohol is not harming me or the cigarette is not harming me, it's these other problems that is causing me damage, but not this. So the difficulty level becomes much more. Again, there is recovery, there is possible recovery that can happen, but it will require again a team effort. You need a good counselor, you need a physician to manage the negatives of leaving something. So there is dependence. So when you suddenly take that chemical away, your brain thinks that something that is normal has gone away, and so it struggles to cope with that. And so you go through this period of irritability, anger, you might have a lot of violence. But if you go past that, then neuroplasticity will take over, your brain will come up with new networks, and then recovery can happen. So it is a team effort, but if with the right support and guidance, it is possible.
Wow, wonderful. Dr. Sid, we started What the Health to help bust myths and get experts like you to really tell us what the right information is, because there's a lot of information available and all of us here are confused. So we have this segment called What the Health, which is busting myths. I have certain myths that we have collected from what we saw people asking, talking, and I need your help to tell me what is true here and what is a myth.
Okay.
The first is we only use 10% of our brains.
Yeah, that's not true. When we think we actually use all of our brains, but the efficiency with which we use our brain is different. So I always give this example of our brain has evolved from a Nokia 800 to an iPhone 15. So at every point it is using its full advantage, it's all of its networks, but the number of processors, the number of transistors in our brain keeps increasing, and the efficiency with which all those neurons connect with each other, that is what is changing. So it's not that you use 10%, but what 100% looks like is different for everyone.
IQ tests are always an accurate measure of intelligence.
No, absolutely not. IQ tests measure certain skills. It measures more of analytical skills. But as more and more researchers are finding out, there are different kinds of intelligences. And musical intelligence is different, sports intelligence is different, linguistic intelligence is different, emotional intelligence is different. So, like we said, in children, similarly for adults, different brains can pick different patterns better, and an IQ test will pick some of those patterns or test some of those patterns. So it's a good marker if those are the kind of intelligences you're looking for. But as an overall level of intelligence, no, not really.
Video games rot your brain and make you more violent.
Absolutely not. That's not true. This is a very, very common myth, which is in every decade, people will find one thing to blame. And currently, we are going through a generation where video games are being blamed. But believe it or not, in the 40s, people were blaming rock music as being the most important. And even before that, people were blaming ballroom dances.
Wow.
So there were adults who would say that kids who go to these ballroom dances turn out to be violent. Like, what is all this? So every generation will find something to blame for one section of society's, one percentage of people being violent. That's not true. Roughly speaking, and in every given population, some percentage of kids will be violent, and it's nothing to do with violent games.
Wow. Memory gets worse as you age.
This is true. When you age, the speed with which your neurons fire, or the efficiency of connections, like I was saying, do go down, and some amount of cognitive impairment does happen with age. Genetics plays a role here. How active you are plays a role here. How active you are mentally and physically, and the quality of your sleep plays a role here. But in general, when you are 70, 80, your calculation power, your prediction powers, these do reduce over time.
Eating fish makes you smarter.
There is some truth to this, which is, I won't say smart per se, but then there are molecules in fish. So there are two chemicals called EPA and DHA. These are both chemicals that your brain uses to form neuronal coverings. And so if you get these chemicals, these are both omega-3 fatty acids. So everybody's heard of omega-3 fatty acids now. And the original form of omega-3 fatty acids was in fishes. Now, of course, you get them in capsules. But eating fish once, twice a week is healthy. And people have, in fact, there was a theory that human civilization developed around water because fish was available. And so eating fishes led to the brain size increasing. So, of course, I'm not really sure if this is proven, but it's a great theory because fishes do lead to more cognitive growth. So, yeah, there is some truth to it. Fish is a good nutritional source.
You can always trust your senses.
Oh, no, absolutely not. No, absolutely not. Your senses lie to you all the time. When you see an image, you are actually conscious of only like 10-12% of what you see. The rest of it is white noise. Similarly for the things you hear, things you touch, because right now we're sitting on a chair, but then we haven't really felt the chair in a while until I said it, right? So now your brain is aware of it, but you are not aware of all my background, because your senses will keep filtering information depending on what your primitive brain or your limbic brain thinks is important. So at any point, you are only aware of, say, 10% of what your senses feel. So no,
Wow.
you can't trust it.
Very interesting. Men and women have very different brains.
No, it's not very different. It's actually almost alike. But the small differences that are there, they really stand out. So that's why people think that it's different. Um, what is important is that, again, because of environment, a lot of these differences get highlighted. And so while it's true that there are hormonal differences and the sensitivity of some receptors are different, the level of estrogen, testosterone is different. Um, Compared to what is similar, this is very, very less. So men and women are a lot more alike than most people think.
Your brain and body can adapt to less sleep over a period of time.
There is some truth to this, but what happens is there is a cumulative damage that happens, which is that your brain needs some amount of regularity in sleep. And so sleep is divided into sleep cycles. And roughly, you need around 4 sleep cycles to get rid of all the toxins from the brain. So if you're not getting enough sleep cycles, those toxins can accumulate. And while it may seem okay for the first 30-40 years, over time with age, the efficiency of those toxins getting cleared will go down. And early onset Alzheimer's, or if you get Alzheimer's early, one of the reasons is toxin accumulation. So if you sleep poorly as a 20, 30, 40-year-old, the effect is seen when you're 60. And then you can't go back and sleep better. So do you really want to find out? It's just better to sleep for 6 to 8 hours.
Makes complete sense. If you have a seizure, you have epilepsy.
So seizure and epilepsy are related terms, but they're not the same. Seizure is a single episode. Epilepsy is a disorder. So if you have one episode where the electric activity in your brain has gone out of control and your hands and feet react to that uncontrolled electric activity, that is a seizure. But if you have 2 or more seizures, then you can say, the doctor will say that you have an epilepsy disorder. And then epilepsy could have multiple causes, and then it goes on. But every seizure is not an epilepsy.
Fair. Okay, so now we move to our Q&A segment. We've also received some questions and I need your help to give them the answers. I'm always stressed. Even the smallest of tasks sometimes makes me panic. Why are some people calm and others like me always stressed no matter how much they try?
So the neuroscientific answer to this is, there's an area called amygdala in the brain that is responsible for identifying threat. Now, how low or how high your threshold is for threat will determine how anxious you are. So if your threshold for threat is very low, then everything is a threat. Somebody looking at you in a weird way is a threat. A phone call is a threat. But if your threshold is high, then nothing is a threat. So people who have figured out, it's a function of control. So how much control do you feel you are in will determine how anxious you are. And that is actually a function of your environment, your childhood. So this is a complex answer, but the one-line answer is threshold for threat determines anxiety.
Hello, Dr. Sid. A few days ago, I suddenly felt really down in the evening and it lasted until the next day. Since then, I've been feeling restless and low on energy. I'm not even sure why I'm feeling sad and I'm finding it hard to even do small tasks. What is this feeling and how do I fight it?
So this connects back with our conversation around depression, which is that a single episode like this is something I feel all of us have gone through. There are moments where we don't feel motivated, we don't want to do anything. And I believe that's absolutely okay. We are allowed to have these mood swings. The expectation that we will be always high, we'll always be on, is too much. It doesn't work like that. But I would say that if this repeats too often, or if this does not end within 48 hours, 24 to 48 hours, definitely time to think about, hey, is something really bothering you? And if you're not able to figure it out, just go and talk to somebody. I would always say err on the side of talking to someone rather than not talking to someone.
Hi, sir. My name is Manish. When I'm surrounded by competitors, I push myself to come first. However, I also feel a lot of pressure that I will be replaced at my job. How can we not be affected by competition and always give our best?
Yeah, when we first enter into a competitive space, we have two options, which is either be inspired or be intimidated. That's usually the choice that we have. And what path we choose depends on the threshold of threat. Again, so when you find yourself competing with somebody, if you can get that competition to inspire you and you're learning from them, great, you can keep going up. But if you find yourself getting too intimidated, that is the equivalent of you at the gym lifting 50 kilos when you should be lifting 20. There is no shame in saying that I want a lower level challenge. So if you find yourself in this position again and again, reduce the challenge and work on that lower level challenge first, and then come back to this.
Do you think competitive personalities tend to be more stressed?
No, I think anxious people tend to be more stressed.
That's
There
a
is,
better sense.
yeah, there is no correlation with competitiveness necessarily. People will find reasons to be stressed if your threshold is low enough.
Hello, doctor. How can I manage my migraines? I experience migraines twice a week. Some days I can tolerate the headache, but other times it becomes unbearable. Are there any non medicinal methods to alleviate the symptoms?
There is actually. So, treatment of migraine is a combination of medication and lifestyle changes. Migraine is a symptom of autonomic dysregulation. So, your brain has a system of keeping stress and calmness in balance, which is the sympathetic and parasympathetic parts of your autonomic nervous system. When this balance goes off, migraine can happen. Conversely, migraine can cause this balance to go off. So, one of the things that we can do is to improve this balance. So, the best research that I have found on this topic is breath work. I would highly recommend anyone with migraine to get into a breathwork program. Pranayam is one thing, which is, and the one that I have found most useful for my patient is something called resonance frequency breathing. In simple terms, it is breathing really slowly. So you are breathing at the rate of 6 breaths per minute. So around 10 seconds per breath, 4 seconds in, 6 seconds out. If you can continue this breathwork pattern for around 5 to 10 minutes, it has an impact on your autonomic nervous system, and that in turn should have some impact on your migraine. It is very possible that just doing this will not have an effect, and you may still need medication. But once your migraine is controlled, this will lead to some effect on the reduction of your migraine symptoms, intensity, duration. So this is something that will definitely not do any harm, and it will only possibly do good. So I would recommend you try that.
Hi, Sid. I'm a 17 years old student and I always find it hard to concentrate and study while my friends are toppers. I always wonder why some people are so talented and accomplished while others seem less capable. Do talented people have different brains? Am I doomed to be average in my studies always?
Oh no. Oh no. When it comes to studies, I strongly believe that everybody has their own style of studying. And one of the things that a student needs to figure out is what kind of student are they? So you can't really copy someone else's style, but you also don't really know what kind of student you are until you try out different styles. So any student who is struggling to match up to your potential, try different styles. You may find that you are a much more visual student, that if you draw diagrams, if you draw flow charts, you will remember it better. There will be some students who can't study while sitting in one place. And because of our traditional classroom structure, that is the only way they've been exposed to. But just try walking around and studying. These might seem very silly things, but it makes a world of difference. Just knowing what triggers your brain, what is your comfort zone in trying to remember new things, how you remember things, these things you have to figure out. So the difference between an average student and a good student is that the good student has figured out how to study. It's not that they are more capable, it's that they figured out what works for them. And the average student has not figured out what works for them.
I love this answer. I wish this was told to me like long ago. Hello, doctor. I have noticed that many of my friends get excited about their birthdays, but for some reason, I'm not feeling the same way about my upcoming birthday next month. In fact, it's making me feel anxious. Is there such a thing as birthday depression? And if so, how can someone overcome it quickly? Hearing this for the
What are
first
these
time.
questions?
Yeah, I'm very specific and very unique.
Yeah, so specific anxieties can happen with anything. And in birthdays, for sure, like there's a lot of attention on you, there's a lot of focus on you. And sometimes it can be overwhelming. It can get a bit too much. There is a lot of social pressure, so to speak, on behaving in a particular way. And a lot of people can feel that, oh, I don't want that attention. And that's absolutely okay. That's absolutely okay. You don't have to do this. But I would still say that if this was a symptom of something deeper underlying, if you have an underlying anxiety about meeting people or making people look at you, that's something that needs to be addressed. It's not about the birthday, but eventually in life, there will be times when the spotlight is on you. And maybe this is the earliest sign that you're not comfortable with that. If so, talk to someone.
I've been diagnosed with mild sleep apnea and used a CPAP device for 2 years. I experienced stomach bloating during the night and stopped using the device. Now I have severe mucus at night and struggle to sleep. Any suggestions? I'm 47 years old.
So obstructive sleep apnea is one of the most underdiagnosed conditions. Many people don't realize they have it. Usually the sign that you can pick is snoring. So when somebody snores a lot, they should undergo a sleep study to figure out if they have obstructive sleep apnea. What happens is you are not able to breathe as well as you should when you're sleeping. And because you're sleeping, you don't realize it. And so your body undergoes some changes in your throat, your blood pressure goes up, you can have headaches, you can have stress. There are multiple downstream effects of obstructive sleep apnea. The treatment is CPAP, which is one, it increases the pressure of the air in your throat. But it's not the only treatment. Making sure that you have your weight loss program is in place, making sure that you change your diet, making sure that your sleep hygiene is in place. All these things play a role in treating sleep apnea. So if CPAP isn't working, there are other things you can do. So this person should definitely meet an ENT specialist who specializes in sleep apnea, and they should meet a chest physician who specializes in sleep apnea. And they should have this discussion because it's possible that they may need certain corrections in their mouth and throat that will alleviate the symptoms.
Is this more common in obese people?
Yes, but it's not specific to obese people. Thin people can also get it, but it is more common in obese people.
I am Zeenath, 21 years old, and I'm struggling to move on from a breakup that happened 6 months ago. It's been really tough. Wow, imagine breakup help from a neurologist. Is there a step-by-step process to help forget someone?
So the reason that people struggle with getting over a breakup is, unfortunately, love is a complex neurochemical process. One of the things that happens in love is your identity changes. So before you've met that person, you are Zeenath. That's her name, right? So before she met that person, she was just Zeenath. After she met that person, and assuming that her brain underwent all the changes that happens in love, identity changes. And now your identity is linked with the other person. And so when there is a breakup and that other person is now no longer in your life, you have an identity crisis. It's almost as if a part of your body is missing. And the recovery from a breakup is basically your brain trying to reform your identity without that other person. And that feels wrong. That feels too painful. So the step-by-step process basically is A, as sad as this might sound, forgiving the other person. Because this is really important, because as long as there is anger and hate, it's very difficult to move on. So forgiving that other person for whatever has happened, you have to forgive them. And B, figuring out what are the other things that you can do to make your identity stronger by yourself. This is as easy as it might sound to say. I know it's very difficult to do, but these are the only two ways. These are the only two steps that you can do.
Hi, Sid. My younger brother is 25 years old. He's an aspiring filmmaker and has been successful in his career. However, he tends to keep to himself and doesn't socialize much. I'm wondering if creative people are usually introverted or if they struggle to socialize with others.
No, that's not really true. The whole idea of introversion and extroversion is kind of overdone, actually, because there are so-called introverted people who are extremely vocal when it comes to their friends, their circle, their family. So I would say the spectrum is on comfort zones, where you find yourself comfortable and where you find yourself uncomfortable. And it is such a spectrum. Everybody is relatively more introverted or more extroverted compared to someone else. So any two people, you take any couple in the world, and they will say which of them is an introvert and which of them is an extrovert, because it is relative.
Fair.
Right? So absolutely not the case that creative people are introverted. It's all a spectrum.
Hello, doctor. Sometimes when I have too much work lined up, I try to pull a all-nighter to meet the deadlines. I stay up till 4 a.m. easily, but get nothing done and just keep scrolling through Instagram or keep talking to a friend. Is this a sign of procrastination or being burned out?
Yeah, I think when you are younger, you can afford to mess around with your sleep time more. But very quickly you realize that later on your body does not give you the same kind of luxury. So the sooner you figure out a sleep cycle that works for you, the better. And yes, it is absolutely a form of procrastination. There is something called what is that called? Last minute productivity or late night productivity, which is you wasted your whole day, but you don't want to go to sleep feeling useless. And so you think that, let me work in the last half an hour and then I'll feel good. So these are just tricks that your brain plays on you. You need to call it out. Sometimes your brain can be like a little child, and you have to call it out and say that whatever happens, I'm not messing with my sleep. So if you have that one rule that cannot be broken, everything else will work around it. But yes, this is a form of procrastination.
Thank you so much, Dr. Sid. That was the last question.
Thank you.
Thank you so much for coming over and really, everything in this chat has been so useful, and I'm sure people will find this episode very interesting.
Thank you so much. My pleasure.